Now it's good to note that NHIF ili grow so fast. And imagine it was growing without control inside a political system that rewards silence. Ebu tuanzie 2003. Na hapa hivi tunaangalia moment ya Kibaki. Kwenye expansion ndo ilikuwa mission. Aya, venye ilifika December 2002, nakwambia NAC ilishinda, na ilishinda on reform language, anti-corruption, institutions, systems. Unaona? So hapa hivi, health ikakuwa political tena. So NHIF ikashift rule. Ikatoka from inpatient cover for formal workers, ikaenda kukua a national social insurance vehicle. Now, between 2003 and 2010, NHIF ilikuwa ina expand benefits. Kulikuwanga na higher inpatient limits, kulikuwanga na more hospitals zenye zimekuwa accredited, na pia private hospitals zilianza kuingia aggressively. So nataka ukuwe very keen and observe, juu hapa hivi ndo power ilikuwa ina shift pole pole. Pesa inafuata accreditation. Accreditation inakuwa influence. So hapa hivi ndo mahosi zilianza kuongea na the NHIF officials directly. Lakini tulia tu hapo, juu the real thunderstorm, the real rain, the real snow, sijui ni the real fire, ilikuja after 2010. In 2011, NHIF ilianzisha outpatient cover. Hii tunaweza ita kupilot. By 2015, benefits za outpatient zikaanza kuroll out nationally. Najua inakaa kitu poa, unaona? Maendeleo. But, structurally, hapo ndo control ilikuwa ina collapse. Let's compare inpatient care to outpatient care. Inpatient care iko na limits. Hapa hivi kuna admissions, kuna wards, na pia kuna discharge summaries. Alafu outpatient care iko na volume. Kuko na many visits, kuko na many claims, na pia hapa hivi kuna small amounts, but high frequency. Simesikia outpatient care iko na volumes. NHIF systems, those ones are not built for volume. So hii ka create space yenye fraud inaishi, unaona? Juu NHIF systems hizo, those ones were not made for volume. So if you have volume, then there's a gap there. Na hapo kwa hiyo gap, sema fraud. Let's change gears. Tukimbia 2016. 2016, Gava ili launch Linda Mama. This was the free maternity care under NHIF. Hapa lazima ukuwe mjanja juu ya the political context. Now, Kenyatta alikuwa na prepare for the 2017 election. Maternal health hapa ikakuwa a flagship promise. NHIF ikakuwa the payment engine. Hapa hivi, hospitali zilikuwa zinarimbasiwa per delivery. Hakukuwa na strong verification, hakukuwa na biometric confirmation, hakukuwa hata na real-time checks. Results were just following incentives. Mahosi zikaanza kuinflate deliveries. Normal deliveries zikaanza kukua complicated deliveries. C-sections. Zilikuwa zina spike. Mahosi huku. C-sections. Reports za Auditor General baadaye ndo zilikuwa zinaonyesha hizi patterns zote. Imagine hosi yenye hata ina theater, iko hapo hivyo ikibill multiple surgeries per day. Imagine. Na sasa hiyo hata ina theater. So venye 2019 ilifika, NHIF iliflag 656 maternity claims. Imagine 656. Lakini hakukuwa hata na prosecution hata moja, like no prosecution at all. Ebu tuongelele pia NHIF kudigitize. Now, NHIF ili digitize through the Health Insurance Claim Systems, HICS. Hii system si yao, wame outsource. It's been managed by third parties huko hivyo. Imagine watu wengine wana manage system yenu. All these things that I'm saying, I need you to go pointing them out. Ukinote. So, NHIF, I control the core technology. Kazi yake tu ni kuconsume my reports. Sasa unaona hapa hivi, kuprocess claims ikakuwa faster. Lakini oversight, venye 2018 ilifika, claims zikaanza kukua mingi. Manze, like the volumes were exploding. Na, ukicompare the payouts between the private hospitals and the public hospitals, private hospitals ndo zilikuwanga na more payouts. Tuongeze pia that the number of staff pale hivyo NHIF haiko inaongezeka. So the audit capacity bado ilibaki manual. Hapa sasa ndo fraud ya NHIF ikakuwa systemic. So unaona ukiangalia between 2018 na 2021, kuna patterns tu zinajirudia. Mapatients hawako, those ones will call them the ghost patients. Claims zinafanana. Imagine a single claim appearing like 5 times. Alafu pia kulikuwa na upcoding. Unaenda hosi juu ni mgonjwa, alafu hosi inakubill procedure yenye hata hujafanyiwa. Imagine ati jua ulipi cash, ni NHIF inalipa. Imagine pia madaktari juu ya kujuana walikuwa na share details za patient. So ukihudumia huyu patient una share hizo details hapo ndo ikuwe billed mara ngapi? Mara 2. Ndani ya NHIF kuna wenye hata wataki kujua ni nini na happen. And it's like this, juu vitu zikianza kukua political, sa utafanya? Hakuna kitu unaweza fanya juu first of all, hizi horses zina belong to powerful people. I'm talking about county elites, I'm talking about former politicians, and I'm also talking about the connected families. Ukijaribu hivi kufungua mdomo, unakuwa transferred. So unaona hata investigations haziwezi fanyika. To change gears tena tufike 2020. Hapa hivi Auditor General anaitwa Nancy Gathungu aliflag billions in irregular NHIF payments. I repeat, billions with a B for boy. Hizi zote ni ma red flag. But hakuna kitu inafanyika. Si COVID ilihit in 2020. Hapa hivi kukakuwa na emergency procurement. My equipment hapa hivi lazima zipatikane haraka. Kulikuwa pia na relaxed controls. Na pia kulikuwa na fast payout. Hapa hivi NHIF ilikuwa ina treat COVID very seriously. Ikiona claim ya COVID, pay. Claim ya COVID, pay. Oversight inaendelea kukua week and week. Do you see why? Aya, 2021, madeni za NHIF zikaanza kukua mingi. Mahosi zilianza kucomplain publicly. Patients, ukienda hosi kulipa na NHIF, unaambiwa NHIF haifanyi kazi, ulipe cash. Si sasa NHIF ikaanza kuogopwa. Ilikuwa inaogopwa na patients, mimi na wewe. Nilikuwa bado inaogopwa na mahosi. So venye 2022 ilifika, we can say that NHIF was trapped structurally. It was just too big to audit manually. It was also too politically entangled to reform internally. Attempts zote za kujaribu kuclean NHIF zilikuwa tu zina fail. Kuna some senior managers wa NHIF wenye waliarestiwa, kuna wenye walichajiwa, but most cases zilikuwa tu zina stall. So clearly system tu ita survive. Na acheni niwaambie, trust ikikufa kwa insurance, fraud inakuwa tu kitu ya kawaida. Now why do you think NHIF could not be repaired? Mimi niko na reasons 3. 1, kugrow hivyo vyote bila controls. Volumes zilikuwa juu sana that it just broke the manual oversight. 2, the political shielding. Like we said, hapa hivi ongeza kuongea ati kuna fraud. Why? Because of the powerful networks. 3, venye tumesema, hii technology yenye wanatumia yenye hata si yao. How can you not control your own data stack? So now, by 2022, NHIF is paying tens of billions annually. Imagine. Leakage hapa hivi ikakuwa structural. Yani, ndani ya NHIF, NHIF and hospitals. Leakage hapa hivi ikakuwa structural. And now because the structure of NHIF was the weakness, hiyo ndio ilikuwa inauma NHIF, wakaona badala to change vitu huko ndani, let's just replace the entire thing. Yote, just remove it tuweke ingine. This is where SHA comes in. SHA was created because NHIF lost control. Waliangalia wakaona NHIF, it's not credible, nothing can be done to save it. Wacha tutulete SHA. Na for this part, tutaanzia September 13th, 2022. William Ruto akakuwa sworn in as the president pale hivyo Kasarani. Hapa hivi, economics za bottom up zikakuwa the governing slogan. And like we've been saying in the previous episodes, health is a very political sector in this country. So, universal health coverage ika move from policy language to political promise. By the late 2022, NHIF ilikuwa ndani ya crisis. Facts zenye zimekelewa kwa meza ya State House na Treasury ni first of all, NHIF iko na madeni above 60 billion shillings. Yes, billion with a B. Second, mahosi zilikuwa zina threaten kujitoa. Third, Auditor General Nancy Gathungu aliflag systemic fraud year after year. Imagine. 4, Linda Mama ilikuwa ina bleed pesa through the duplicate maternity claims na hizo masi-sections za uongo. 5, we are still on the facts zenye ziko juu ya meza ya State House na Treasury. The HICS system was opaque, haikuwa ya NHIF kwa hivyo inakontroliwa huko nje na ingeweza kuauditiwa. And 6, the public trust. Huku hivi Kenyans, hakuna mtu alikuwa na trust NHIF. Those were the facts zenye zilikuwa juu ya hiyo meza. Hapa hivi, NHIF haikuwa insurance, ilikuwa tu inakaa pipe ya kulipa mahosi. So, timu ya Ruto ilikuwa inaangalia hapa hivi inaona, na ni kama NHIF ina collapse. Tuingie early 2023. Hapa hivi, the internal treasury and health briefings zilianza kucirculate. Conclusion ikafikia cabinet. Ati NHIF imeoza, like the structure is just rotten. Ati tukishinda tukitengeneza itakuwa expensive. So decision ikaland, NHIF haitafixiwa, itareplacewa. And to be honest, NHIF si ya kwanza imefanywa hivi. Hii ni kawaida huku Kenya. Institution ikioza, design hizi repairiwa, tuna decide tu kuiua kabisa. A good example ni KPC, NYS na NCPB. It's just the same pattern over and over again. So, in February 2023, drafting ikaanza. Na hii ni drafting ya kureplace NHIF. Come November 22nd, 2023, Parliament ilipass the Social Health Insurance Act. Hapa hivi kulikuwa na 3 funds yenye inge replace hiyo moja. Primary Healthcare Fund, Social Health Insurance Fund, na Emergency and Chronic Illness Fund. Hizo zote tatu ziko under the Social Health Insurance Act. Unaona venye hii language ina sound technical, but intent hapa hivi bado ni political. Control ilifragmentiwa na at least kulikuwa na visibility flani. Unaona hiyo kusegment those 3 areas, the Primary Healthcare Fund, the Social Health Insurance Fund, and the Emergency and Chronic Illness Fund. Hiyo ni kitu NHIF haikuwa inafanya. NHIF tu ilikuwa ina collect pesa blindly. At least SHA ilikuwa ina separate purpose by design. So kaende, Treasury ikadecide kuback your model. Same as the IMF. Now the reason why this thing was backed up so well, ni juu it's very difficult to steal from segmented funds. Mapatterns zitasurface haraka. Now the first mistake that was made here was the timeline. Imagine, NHIF admissions zili end September 30th, 2024. SHA ikaenda live October 1st, 2024. Hakukuwa na test, hakukuwa na migration, sijui time to do what, immediately, yani overnight. Now the question here is why the rush? And the answer is simple, politics. By mid-2024, pressure ilikuwa inapanda. Kulikuwa na maprotest juu ya cost of living, kulikuwa na anga uko hivyo juu youth hawana employment, kulikuwa na tax backlash, na mahosi pia zilikuwa zina demand kulipwa pesa yenye wako wamelipwa. So hapa hivi, gava inataka a reset headline. Sio kitu ya polepole ati polepole. SHA ikakuwa a proof of action. SHA was sold to the public as a break from NHIF. Na Ministry of Health ilikuwa inashinda ikirudia hizi points. Mara biometrics itastop patients wenye hawa exist. Mara AI itaflag fraud. Mara kutakuwa na real-time claims. Mara hakutakuwa na manual overrides. Mara hakutakuwa na cartel capture. Sorry, I'm just saying them like this because hizi ni points zenye Ministry of Health ilikuwa inashinda ikirudia. So unaona hiyo message ina shape expectation. But behind the scenes, systems zilikuwa zinakuwa procured under agency, integrations zilikuwa incomplete, the provider empanelment ilirashiwa, alafu the staff retraining ilienda into weeks. Technology ilifika before governance. Let's talk about the money question. Juu hapa hivi watu walikuwa nasikia 100 billion, wengine walikuwa nasikia 104 billion. Anyway, hii pesa ina represent nini? Ina represent the core system build, ina represent the vendor consortium, ina represent data migration, ina represent hardware, ina represent integration with NIN and biometrics, na pia hiyo do ina represent maintenance contracts. Ido ilimwagwa just once because these people wanted something to launch right now. Yani walikuwa nataka kitu ya sai. Now there are so many assumptions behind SHA. I'll not talk about all of them, but nitawapea to just one fact, and that's the answer to all these things. Fraud lives in the claims. Fraud haiko kwa registration, fraud haiko sijui kwa president, sijui president amefanya nini. Fraud lives inside the claims. Now, NHIF fraud ili evolve over decades. Sasa venye SHA ilianzishwa, si ilipata expert fraudsters from day one, cause NHIF, imagine from time ya Kenyatta, I told you guys. So from day one, SHA ikusamehewa, ilipata watu wenye wanajua game. Mahosi zilikuwa zinajua playbook, app coding, phantom admissions, OTP manipulation, and staff collusion. Guys, I hope you're listening, cause this is hapa ndo pesa ilienda, hapa ndo pesa ya SHA iko. So SHA ilikuwa inaingia a very hostile environment. Anyway, tuendelee. A transition committee ili wind down NHIF by July 2024. Tasks zenye zilikuwa zimeasainiwa kwa hii committee ni asset transfer, staff absorption, data migration, and contract closure. Lakini reality kwa ground, dirty data was moving too fast, provider histories, they were incomplete, the risk flags were lost, and human discretion was preserved. The old ghosts, they were able to cross the bridge. Now, from my research, I found out that SHA was a political reset. Ili inherit vitu nne mbaya sana. One, ili inherit providers wenye walikuwa wametrainiwa under the NHIF fraud culture. 3, SHA ili inherit a weak enforcement memory. Hapa hivi ungedhania behavior ndo ita change. Ni technology pekee ili change. You already know, SHA officially went live on October 1st, 2024, and the NHIF admissions, they stopped on September 30th, 2024. Millions of Kenyans, they woke up inside a new system overnight. Now this speed, it mattered politically. Number 1, Ruto's administration, it had framed SHA as a proof of delivery. Number 2, universal health coverage, it had deadlines. Number 3, Budget cycles, they were closing. And 4, public trust in NHIF had collapsed. So here the order was simple. You switch fast, you fix later. Now let's look at what SHA inherited on day 1. It inherited incomplete NHIF data. It inherited duplicate member records. I remember I told you this. It inherited facilities empaneled under old standards. And SHA also inherited providers trained on NHIF logic. There was also a technical gap. SHA relied on the Integrated Health Information System. Now that system, it was live, but the full biometric enforcement was not. OTP authentication, it still sat between patient and claim. Manual overrides, they existed for emergencies, and bulk claims pipelines, they stayed open. Now I need you to remember that because fraud, it needs gaps, and from what I've just said, you can see how many gaps were there. There were empanelment failures. There were facilities being approved using paperwork. Some inspections happened, but many did not. Again, these gaps that bring fraud. Imagine a level 3 clinic, it could self-declare capacity. You know, the bed counts, theater access, staffing. To add salt to the injury, verification lagged behind approvals. This allowed the facilities to enter the system first, and then the questions came later. Let's look at the provider behavior shift because this one, Under NHIF, claims moved slow. Under SHA, reimbursements moved faster. The providers noticed this immediately. The claim volumes, they spiked in October and November 2024. Hapa hivi, inpatient admissions, they were rising sharply. Maternity claims exploded, and C-section ratios, they crossed medical norms. In this particular period, when SHA was brought in, it was just mad chaos, like the chaos continues. The manual overrides. Also, hospitals used emergency clauses to bypass biometric failures. The claims officers, they were approved under pressure. This chaos. Patients needed care, but the system stayed unstable. This manual approval, it became routine. And this is where the money started leaking. Because you know, everything that is manual, questions. Now we also need to talk about the OTP abuse because these facilities, patient OTPs were reused. And then after being reused, they were shared to other facilities. These facilities, you know, they're working together to milk as much money as they can. The same patients' OTPs. Claims got filed for visits patients never made. Admissions were being logged remotely. And all this was happening before the AI full enforcement kicked in. Now we can also look at the geographic clusters. Some certain counties, they lit up early. And I'm going to mention them. Mandera, Nairobi informal settlements, and parts of Kisii and Bungoma. Hapa hivi, we had the same patterns, the same codes, and the same clinicians across facilities. Imagine, here the system was just seeing volume. Now I know we are all asking, why couldn't SHA stop this immediately? Well, because October 2024, it was survival mode. The hospitals, they were threatening boycotts, patients flooded public facilities, and the political pressure stayed high. Stopping claims meant collapsing care delivery. So SHA paid and logged and watched. Most of the 11 billion shillings, it leaked here between October 2024 and early 2025. Between October 2024 and April 2025, at least 11 billion shillings left the Social Health Insurance Fund through fraudulent claims. This figure comes from the Ministry of Health internal audit, and it was confirmed publicly by the Health CS Adendwale in January 2026. Now, this was not just one scam. It was like many techniques just stacked upon each other. So many techniques. So the first technique, because we are going through all of them, is ghost hospitals. Now, a ghost hospital is a registration problem. Facilities like Trenya Hospital Limited in Kisii County, they were registered as level 3 hospitals with theaters, wards, beds, and staff on paper. But physically, nothing existed. Imagine Trenya operated without a building. Imagine. Like there were no wards, there was no theater, there was literally no equipment. Let's talk about the owners. There are two people here. One, Nicholas, who is a former hospital claims officer in Kisii. And two, we have Oyaro, who's an anesthetist based in Homa Bay. Both understood the claim systems better than the clinicians. That was the advantage. They registered the facility during the SHA transition window when empanelment relied on uploaded documents instead of physical inspection. You remember this transition window? It lasted from October to December 2024. Now, once empaneled, they did three things. First, they harvested patient credentials. You know, the national IDs, the OTP codes, and the SHA numbers. Some of these came from patients treated elsewhere, some came from insiders inside hospitals, and some came from social engineering. Second, they admitted patients digitally. And those admissions, they lasted hours instead of days. Imagine, no patient ever arrived. 3, they upcoded services. The outpatient visits, they became inpatient admissions. Where here, simple cases, they became surgeries. Each fake inpatient admission paid roughly 3,920 shillings per night, excluding procedures. By August 2025, Kenya alone had received over 10 million shillings. Imagine. How many times have I said imagine? Now, this was flagged by RUPHA whistleblowers, not the SHA audits. I hope you're hearing. And if you see me smiling, I'm just smiling because this is just so ridiculous. So after the whistleblowers, when KMPDC inspectors visited, they found a farmland instead of a hospital. Imagine, and 10 million shillings has already been paid to this hospital. Now, the second technique that was used to steal money from SHA was upcoding. And I'm telling you guys, this is the most profitable fraud. This is where the real money was. Hospitals took real patients and changed the story. A malaria visit became an inpatient admission. A consultation became a surgery. A normal delivery became a C-section. And why C-section? Because they pay more. Now, SHA data flagged facilities where 90 to 100% of births were cesarean. Imagine some facilities were recording 90 to 100% C-section. Imagine, even WHO, it sits between 10 to 15%. And these facilities that were recording C-section, they had no theaters. Now, the counties flagged for this pattern include Mandera, Nairobi, Bungoma, and Kisii. In Mandera County, 18 facilities collectively accounted for over 112 million shillings in suspicious maternity and inpatient claims. The fraud relied on volume. You know, small claims multiplied hundreds of times. One Nairobi clinic logged the same patient admitted multiple nights without discharge. Another clinic billed the same procedure across different days. Allow me to say imagine one more time, because at this point, SHA rejected 10.6 billion worth of claims by October 2025. Those ones were caught late. There are 100 billion shillings that we are talking about. It refers to money already paid. Another technique being used to steal money from SHA is the outpatient to inpatient conversion. This one was the easiest trick. SHA reimburses inpatient care at a higher rate. Facilities were converting outpatient visits into admissions. A patient visits once and the system records admission. Then the discharge happens digitally. Imagine, with no bed and with no overnight stay, all this is happening. Hospitals claim the nightly rebate plus procedure fees. This was common in Homa Bay County, Kisumu County, and Nairobi informal settlements. Some public facilities were implicated. And this is where the scandal stops being a private sector only. The fourth technique being used to steal money from SHA is the duplicate and multi-site billing. You know, same patient, same ID, and different facilities. Claims officers or clinicians with portal access, they submitted claims across multiple hospitals. This worked because SHA initially lacked real-time cross-facility collision detection. That was introduced later. Clinicians blocked by SHA by August 2025. They included 18 doctors and 22 clinical officers. These ones were enablers. The facilities were the vehicles. Fifth technique, let's talk about the Nyandiwa confusion. This is when a real hospital looked like a ghost. Nyandiwa Level 4 Hospital is in Diwa Sub-County in Homa Bay. It was paid approximately 19.9 million shillings. Social media called it a ghost hospital. Now SHA defended it. They said the hospital exists and it has been operational since the 1970s, and it was originally a dispensary. The confusion came from an abandoned county building nearby. The photos were going viral. This here, it shows something dangerous. In a fraud storm, real hospitals get accused, and the fake ones, they hide longer. You can see here, Nyandiwa became symbolic, but it was not fraudulent. Kenya was fraudulent, but it was not symbolic. Now, why did this fraud happen so fast? SHA replaced NHIF too fast. NHIF admissions ended September 30th, 2024, and SHA started October 1st, 2024. You see, there was no gradual migration. Second, the manual overrides. The early claims, they bypassed automated checks. Third, empanelment gaps. Facilities were just trusted on documents, and this created a gold rush. So who knew and when did they know? By March 2025, internal SHA analytics flagged abnormal patterns. By August 2025, CS Adendwale, he suspended 40 facilities. By August 2025, another 45 facilities were suspended. So total facilities that were suspended, they were 85. By September 2025, 1,188 files, they were forwarded to DCI and EACC. As of January 2026, 24 cases have been marked conclusive. There has been one public arrest because of a 25 million shillings fraud, and there is no high-profile conviction. Money is just moving faster than justice. I think this has been a good episode, and now we understand where the money has been going. Now you can look and follow the money, follow the trail. And if you want to keep looking at the money, following the trail, just tell me in the comments. Also help me by commenting. You know, sometimes you people just watch and then it's like you just watch and watch. You're not talking to me. Correct me the places where I might be wrong. Let's add information because we have to understand these systems. 2027 is coming and they're going to lie to you using another system. They're going to bring another insurance. They're going to do all these things. So you have to car rather. In the next episode, we are going to be talking about Coco, and I wanted to post, it's ready. I wanted to post it, but now this SHA, it's just a headache that we have to keep digging. And it's not stopping here because we have to follow the money. For all these corruption cases, follow the money. This is just Catalina and I love you guys. I'll see you. What? Nimeanza kumalizia video kama YouTuber wa ukweli. Bye guys.